Evening, everyone. It is 7:04 p.m. on the 19th of October, 2022. This is the Community Services Committee of the Norwalk Common Council. I'm Chair Dominic Johnson. I'm calling our meeting to order, and I'll start with our roll call. Again, at 7:00 was 7:03, now 7:04. I see Councilmember Greg Burnett. I see Councilmember Nicole Ayers, Councilmember Heidi Alterman, and Councilmember Barbara Smith. Councilmember Brian Meek is not in attendance, but that means we also do still have a quorum, so we can continue. I also see that Councilmember Revolus is not in attendance, but we obviously still have quorum, so we're good. Fabulous. So our roll call is finished. We do now have the opportunity to move on to public comment, and so I will check to see if we have any folks in attendance. I do see one, Audrey Kozerin, and I believe I'll just ask, everyone on the Zoom who would like to make public comment, please raise your hand on the Zoom, and we will know to promote you to panelist. And there's Audrey. Evening, Audrey. How are you?
I'm fine. Actually, I wanted to view the meeting. I don't have a particular comment except to carry on and do what you're doing well.
Very good. Sorry to inadvertently promote you, but nice to see you. Have a good evening.
Okay.
Thanks for watching.
Sure, have a great evening. Sure.
Thank you. All right. So anyone else on the Zoom here? I don't see any other attendees. Any other public comment for anyone here on the Zoom? Going once, twice. So I guess I will move on to ask if any of the committee members have received correspondence in between the last meeting and this meeting from the community, from residents. None. I have not as well. Chair Daniels, have you received any?
No, I have not. Thank you.
Oh, very good. I take that as then we can close public comment for this evening. So we will close that and we can move on to item number 3, approval of the minutes from our meeting held on September 21st, 2022. Do I have a motion to approve our minutes? No one.
Motion to approve.
Councilmember Alterman, you get it. Thank you. Thank you for making that motion. Very good. So we have a motion to review these minutes on the floor. Any additions, corrections, changes? I did see one, and now it's escaping me. But if I find it, I will email it in. I believe it was just a typo and it wasn't a substantive. It wasn't a substantive thing. Anybody else? We're good. Okay, so we will. This motion is to accept the minutes as I think we're fine. We'll just accept them as presented, and we can call that vote now. All in favor of approving the minutes? Raise your hand or say aye. I assume. Councilmember Smith, are you good?
I'll need to abstain.
You're abstaining. Yes, that's
Yes.
right. Okay, so we have Councilmembers Burnett, Johnson, Alterman, and Ayers, yay, and Smith abstention. Very good. Thank you very much, everybody. Now we're moving on to 4, discussion. We're going to have this evening, as we see on our agenda, some really great updates, a guest presentation. So I want to thank our guests for being here and some really important updates from our chief. So I'll pass the floor over to our chief and our health department. Thank you. Evening, chief.
Great. Good evening, council members. Good evening, Norwalk. So we have before you this evening some updates from Deanna and Brian, and then we'll look forward to our presentation from our guests. So I'll turn it over to our health director, Deanna Diamore.
Thank you, Lamont. Good evening, everyone. So I'm joined by Brian Weeks, our Program Director of Epidemiology and Informatics. I'm going to ask him to go first with his surveillance updates.
All right, thank you, Deanna. Here, let me just switch over to sharing my screen. So everybody, all right, it's update time. All right, so kind of as we've done in the past, we are going through the Coven Data Hub. Again, that's norwalkt.org/COVID data. And so first off, most importantly, in terms of the COVID situation, is just getting a high level understanding of what's going on. And that is our CDC COVID-19 community level. So Fairfield County is currently at the medium level. It's held this for the last couple of weeks. And so it's just important to keep in mind what medium entails. And again, that means staying up to date with the COVID-19 vaccines, getting tested, you have symptoms, and especially staying out of work or school, whatever other activities you may be engaging in, if you suspect you may have any symptoms associated with COVID. Those at higher risk for severe illness should check with their healthcare provider about other prevention measures they should do, along with, whether wearing a mask would actually be beneficial. For those that choose to wear a mask, by all means, again, medium means we're in the middle. And keep in mind that this data is looking at not only the case rate for the county, but also in terms of the healthcare impact. And so that's, new cases entering the healthcare system in the last 7 days, as well as the percent of inpatient beds that are, COVID positive patients. So it's just an important thing to kind of keep in mind. So as we scroll down, again, those are just our kind of resources with the Norwalk COVID Info Center, again, about testing and vaccination. Just want to kind of look at the case rates. So this is the case rate for the last 7 days for the big 7 Connecticut cities by population. And as you can see over the days, when you look at Norwalk specifically here, you can see how the data's kind of jumped. You can see how we went from just a couple days ago of 52.92 per 100,000 to 60.8 and then 70.93. So that's something just to keep in mind. This data does fluctuate, right? And we're also kind of in a unique situation where a lot of people are doing at-home testing. So keep in mind, this is testing that does get reported. So this means this is being conducted at some sort of healthcare facility or institution that does report this information. So keep in mind that, it varies. And as you can see with different cities and towns, they have a different experience as well. Some might be going down, some might be going up as well. But as of late with this data for Norwalk, we're at, in the 70s, which is a jump from where we were before. As we move forward, especially with the hospitalization data, because this definitely indicates severity of illness, not too great. As you can see, just again, looking over the many, many weeks that we've had and dealt with Omicron in the summertime and then subsequently now in the fall time, you can see how it's been a gradual incline. It has jumped around here and there, and that's just natural with, inpatient census data. But we're in the 400s and we're at 432. And when you break it down by county for the most recent data point that just came out today, Hartford County is the highest at 149 COVID positive inpatients, New Haven County 116, and then Fairfield County at 105. So not great to see this going up, but it's something we obviously been communicating about and very well aware of, because I know I mentioned it many a time. And again, I apologize if it's a little redundant, but as we move forward in this colder weather, less opportunity to kind of keep one distant and reduce the risk of infection, as well as just more social activities as we get closer to the holiday blitz with Halloween. We have Veterans Day, we have Thanksgiving, we have Christmas, Kwanzaa, we have Hanukkah, we have every holiday you can kind of think of pretty much. And so it's all coming up, as we're well aware, and then vacations and other social events tied to it. So in terms of vaccination status, because then again, that's one of our best measures to really mitigate this, especially now that we have this new bivalent booster. For all ages, for the city of Norwalk, and this is data up to October 12th, for those of initiated vaccination, we're at 89.42%, fully vaccinated 80.62%, and additional dose received, or AKA booster doses, 44.19%. I think the other important data set to kind of look at too is just keeping us on the loop of what's going on is that wastewater monitoring, because as long as somebody's obviously using the sewer system, it is making inside, especially Fairfield County, this is data looking at Fairfield County, that information is getting reported and evaluated on, a twice weekly basis. And so when putting those data points together from BioBot, the company that's doing this with CDC funding, as you can see, the data does indicate an uptick even there. And so that's also a very strong indicator, along with the hospitalization data and what we're even seeing for Norwalk. Relative to Fairfield County, we're definitely seeing an uptick at the moment. So, this cold weather is starting to have that impact that we anticipated. And now with the mixture of holidays coming up very soon, as I mentioned, not a good mix. So with that said, the other thing I wanted to show you guys, and it's been in the news quite a bit, and I think it's important to emphasize, because this is also not a great indicator of what's to come in terms of a little ominous, but nonetheless, we have a lot of new variants out there. And so the big ones that are getting attention, some of them are the BQ.1.1 and BQ.1, even BF.7, as you can see here in the respective colors, which are mostly shades of green. We know BA.5, it's been something we're very familiar with. It's been here for many months. It's been kind of the ruling, subvariant and variant, in the mix here. But, BA.4.6 was starting to take the lead. And so BA.5 is at 68% about, BA.4.6 at 12.2%. But what's really entered the picture are those variants that I just mentioned, BQ.1.1 and BQ.1, BF.7, and there's others. It's not just limited to that. There's been a lot detected, and when the CDC adds it to this list, they have to obviously meet some criteria, and one of those is at least having a certain level of circulation at a national level. So if it's entering here, it's something very much obviously to be a variant of concern. It's something we are observing and keeping a close eye on. So not great news, because the news has been with BQ.1.1 and BQ.1 and some of the other ones that they do have greater ability, given that they have a lot of kind of spike protein differences from what we're used to, especially with BA.5, that they can evade some of the vaccine. They can also evade some therapeutics too. So that is not great news. And as you can see, looking at the greens are increasing in proportion over time with the nowcast model from the CDC. And as you look at it from a regional perspective, keep in mind those shades of green, again, BA.5 is still the majority in most regions. But you can see how, especially region 2, which includes New York, New Jersey, and Puerto Rico and the U.S. Virgin Islands, is like one of the largest proportions of that. So that puts us kind of right next to ground zero once again. But also the South, like, Texas and areas like that also are experiencing a decent and sizable proportion and growing proportion of those variants of concern that I just mentioned. So something to keep a close eye on. But given what we know with our experience, once Pandora's box is open, so to speak, with these variants, they kind of run their course. And given that they may have higher infectivity and greater evasiveness of the existing, maybe the vaccines and therapeutics to some degree, they're going to have some success in obviously spreading. And then if obviously we give more conditions, or have more conditions that play into it, thus like the cold weather, as well as the holidays. So I just want to really hit that point home, and that also ties in nicely with influenza. Just like what we're seeing with the data, the South, Southeast, the Northeast, and even parts of the West Coast, including, especially California, are seeing that increase in influenza activity. And that's just going to be something we know that's going to keep continuing to increase over time. But it's going to show that we really are entering truly the winter time. If you don't feel it with the weather, you definitely could see it with the respiratory illness data. And then that also kind of ties in nicely. There's a great news article from the Hartford Courant, excuse all the ads and everything that they have on their webpage. But, this is also testing, the big thing, the healthcare institutions, as we're still in the very early stages of this. And so there's even, one healthcare system that's already kind of in the talks with FEMA to set up an auxiliary site, just to support, potentially incoming patients, especially from a pediatric perspective. So we are also seeing, pediatric respiratory illnesses, not necessarily just limited to COVID and influenza, but also with RSV and other kind of respiratory illnesses that we typically didn't see at these levels, that are definitely, kind of showing up and rearing their heads. And part of the argument there is because of our prevention measures in the past with masking and, and now it being loosened up, we're kind of making up for lost time in some ways, because a lot of these young kids have not been exposed to these viruses that they typically would be experienced through the normal course of pre-pandemic times. And so now we have this in the mix as well. So again, not a great suggestion in terms of ominous upcoming winter season and what we're dealing with right now moving forward. So, but it's also word to the wise, again, with the CDC community levels, if anybody wants to choose to wear a mask, definitely moving forward would be a more logical time for somebody to do so, in consideration of all we're kind of encountering now and as it builds up over time. So switching gears a little bit, this is now monkeypox, because we were dealing with monkeypox, and I just wanted to kind of give y'all an update. As you can see, great portion of the country did get impacted. When you look at it by volume, proportion-wise, you can see how California had the largest proportion of volume with 5,278 confirmed monkeypox cases thus far. New York at 4,057. And you kind of, usual suspects again in terms of large states, obviously going to have, more likely a greater risk or impact in terms of volume. And then you can make your way to Connecticut, which is at the most recent data from the CDC at 138. And so in switching gears to the state health department, again, what's great here is it's holding from at 138 with even the state health department data, because keep in mind this is updated once weekly on Tuesdays. And so again, that also suggests this, the stabilization and the gradual decrease in the number of monkeypox cases, as you can see here as the week-over-week data. You can really see how. Here, let me just move the Zoom bar that you can't see, but it's in the way for me right here. But you can see here that we had a peak of that 17 for that week in August, so mid-August, but and we had a little bit of recurrence before we had that little dip there where it went down to 11 and 10 in September. But you can see it's been a pretty noticeable decline over time, and we're hoping this stays. So this is really good news that at least monkeypox is subsiding to some degree. But the catch is, like I mentioned, we got a lot of social holidays. And as we know with monkeypox transmission-wise, it's a lot of close, prolonged, intimate contact that typically would help the virus succeed in terms of transmission. So that could change the course and trajectory of this. So that is something I do want to caution us all and remind us all, we're not out of the woods yet. But it is good to see for the state of Connecticut at least a noticeable decline over time in terms of the recent week-over-week data. Again, what that has concluded thus far is Fairfield County still having the largest volume of those monkeypox cases. Age grouping wise, still 20 to 29 being the largest proportion, but it is following kind of a very kind of linear trend downwards in terms of the older the age group, the lesser the numbers, but still, again, all age groups have been impacted in some degree. In terms of gender, it's still very consistent here in terms of this metric in terms of majority male. And race ethnicity wise, you can see how the large number is non-Hispanic white at 51, followed by Hispanic at 41, and then non-Hispanic black at 31. So just wanted to kind of just remind us again, not out of the woods. It's really important that we keep this in mind as we move forward into a lot of these social holidays. The other thing is, even though it's pretty cold, I actually was successfully bit by a mosquito even just the other day. So they're still out there. And so I just wanted to kind of remind us all that, this is still one other thing to kind of consider in the mix. We're at 7 human cases that have tested positive for West Nile virus. So again, emphasizing that point. Like I mentioned in the last meeting, we had a couple of those human cases in Fairfield County, especially Lower Fairfield County, as well as we just had the largest density and volume of West Nile virus positive mosquitoes, which is, again, very noticeable pattern, as you can see here. So that includes us, Norwalk, who actually technically were kind of in almost the top 5 here for the largest number of mosquitoes testing positive for West Nile virus as well. So just, again, another forewarning until we get to that real good solid freeze. You still have mosquitoes kind of floating around at those hours that you would obviously expect them, dusk to dawn, and so it's just really important to be mindful of that. But it's easier with this cooler weather to layer up, wear long sleeve shirts, long pants, and then obviously using your insect repellent as needed relative to activity. So that is my update. Thank you, everybody.
Thank you very much, Mr. Weeks. I appreciate that. Should I keep the floor over with you, Director Demore, or would we like questions?
Sure, I can give a few quick updates if you want.
Yes, that would be great. Okay. Thank you.
So just to build on what Brian is saying, just want to make sure everyone is aware of some of the changes in the COVID-19 testing site in Norwalk. There's been some expanded days. So Tuesdays 2 to 5 p.m., Thursdays 10 to 1, and Saturdays 10 to 2. There is a new testing provider, Ren Labs is providing it, and it's now saliva testing. So there's some instructions and guidance related to that we have listed on the website, but one of them is you're not supposed to eat or drink 30 minutes prior to getting the test. So I just wanted to remind everyone of that. We've been busy, our staff and our volunteers, emergency response team volunteers have been busy supporting COVID-19 booster clinics. And then we also have several flu clinics coming up this month. One of them is tomorrow at the Norwalk Senior Center. We have clinics weekly at the health department. And then we also are going to Brian McMahon High School November 3rd in the evening. So we're encouraging everyone to get their flu shot.
Excellent. Thank you. I saw Councilmember Burnett at my booster clinic at City Hall. You all did an amazing job. Thank you. And thank you for those updates. The flu shot, as I know we talked about last month, is really crucial this year because I believe it's not a great outlook for the flu season. Is that right, Director DeMore?
Correct, based on what we've been seeing in the Southern Hemisphere and early indications now for this season.
Okay. Thank you. Any questions or comments from our committee members about our health department presentation? I think we're good. You answered my question, Brian, about kind of the new variants, and so we'll just have to watch this closely. It's striking. So thank you all for this information. I really appreciate it. It's good for us to be able to prepare and share this with our community. So thank you for everything you're doing. Appreciate it very much. Anything else in the health department? I know I follow the socials. You're doing some really good stuff. Anything else? Not to put you on the spot, but anything else? You've been busy.
I'll just mention we're in the middle of updating our strategic plan, and can't wait to come back at a future meeting to give you guys a comprehensive update on that. If you'll have that, if you'll. But,
oh yeah,
happy to update you on that in a future meeting.
That's fabulous. Thank you. Thank you for offering. That's great. Great things are happening. Thank you. All right. I think that means thank you, Director DeMore. Wonderful to see you. Thank you, Mr. Weeks. Brian, we've got next on the agenda our guest presentation. So I will put the floor back in Chief Daniel's hands to introduce our two guests, Jesse Bucklo and Ria Henry. We're going to be talking about the Norwalk Workforce Development Initiative. Looking forward to this very much. Thanks, Chief.
Yes, thank you. So as I prepare to introduce, I want to just bring us back to about 3 years ago, and that's when I came to Norwalk and presented to this committee. And I shared that one of my charges was to identify what are those needs where we believe the city of Norwalk, meaning the municipal side, can participate, share, support, or uplift, or just promote and identify where those gaps are. And unfortunately, at that same time, I think 3 or 4 months later into my tenure here, COVID hit. And so, a lot of the movement that from a social service, community services perspective was put on pause. But I'm also excited in that same vein that our public health department led by Dina DeMore, her team and her leadership became front and center. So the public became more aware of the importance of public health and why public health is important. So I always want to recognize Deanna's leadership because she truly has led the way for our city to ensure we were responsive in supporting our residents through those trying times. So I'm excited, and I hope you all will be equally as excited, because one of the issues that we identified almost 3 years ago was workforce development. And in the city of Norwalk, and we all know that we are the 6th largest city, Norwalk does not have a local workforce development organization. And you've heard me many, many times with many of the services, and I see Chair Johnson, I think you know what I'm going to say, that in Norwalk, for the larger services that are often regionalized, our residents have to travel either to Stamford or Bridgeport. And when we think about our most vulnerable and those that are challenged in many ways, that can be a barrier and can be quite difficult, whether you're taking Uber, train, or bus, that costs. And so fast forward to the American Recovery Act funding through the Biden administration, and Norwalk has received its funding. I was really excited that one of the eligibility items was workforce development. And we know in Norwalk, many of our residents, especially those in the hospitality community and in the landscape community, were really hit hard. And many of them are still bouncing back, identifying what those next steps are and where to go and whether career change and building skills. And so through the ARPA funding and through your support and your approval, when I presented our request of how we were going to use the funding, workforce development was front and center. And so tonight, you're going to hear what that investment is now doing, what it plans to do over the next year, and why I believe this was the right decision to do to make this investment to workforce development. And we have decided as a city to partner with Norwalk Acts. And so I would like to introduce to you, to the committee, Jesse Bucklo from Norwalk Acts, and the first, I believe, in our city, Ria Henry, who is the Workforce Development Coordinator on behalf of the city of Norwalk in partnership with Norwalk Acts, where our funding has supported her role to really ensure that not only do we know what's happening across the state and region, but we have a dedicated person with a lot of people supporting her, of course. She's not doing it all by herself, helping us put front and center, promoting workforce development, ensuring that our residents here in Norwalk are aware of resources and services. So I'm going to turn it over to Jesse and Ria. They're going to kind of share, where we started, where we are, where we began, and where we are now. And then all three of us together collectively will respond to any questions that you may have. So Jesse and Ria, thank you for joining us. I'm so excited to have you with us this evening. So Jesse and Ria, take it away.
Thank you, Chief Daniels, and good evening, council members. It's good to see you all. Thank you for giving us the time to present where we're at with our work right now. I'm Jesse Bucklo. I'm the Director of Strategy and Operations for Norwalk Acts. I've been at Norwalk Acts for a little over 2.5 years. Prior to this, I was a high school teacher. I was born and raised in Norwalk and a current resident, a proud resident. And I'll turn it over to Ria to introduce herself.
Hello, everyone. Thank you for having us. My name is Ria Henry. I am the Workforce Development Coordinator here at Norwalk Acts in partnership with the city of Norwalk. I've been on the job about 8 weeks now. It's been a good 8 weeks. Not a Norwalk resident, but a returning Connecticut resident. So prior to this position, I do have some experience in workforce development, having worked for a national nonprofit that focuses on assisting communities establish workforce development programs and youth development programs. I'm really happy to be here and to share a little bit about our work and our aspirations around this initiative.
All right, so I'm going to share my screen. Can you see it? Awesome. So as Chief Daniels said, we're here to share kind of why there's a need in workforce development here in Norwalk, and why the investment into workforce development is critical for the opportunity that we have here. Before I dive into that, though, I just want to share a little bit more about Norwalk Acts. We are a collective impact partnership that brings people together in a structured way to achieve social change. And so collective impact is really rooted in the idea that no single entity on its own can create large-scale social change. And our work as staff of Backbone is really to support this partnership and to make sure that we're helping to coordinate systems to work collaboratively. So I just want to share some key data points about the Norwalk population, our residents and our young people, and why there's a need here for workforce development investment. The first is the top left graphic around ALICE households. So ALICE is this term that United Way crafted that stands for Asset Limited, Income Constrained, Employed. So it's a jargony title, but basically these are folks that are above the poverty level line, but still not making enough to afford the basic needs for the cost of living here in Norwalk. So when we combined the ALICE population with the poverty level, that's over 1,400 households here in Norwalk that are struggling to afford basic needs. And that's 43% of our population. The second piece that I want to bring up is around our Norwalk Public School students. If we were to average kind of the last 4 graduating classes from 2016 to 2020, an average of 30% of those graduating seniors did not enroll into a 2 or 4 year degree within their first year after high school graduation for whatever reason. And when we kind of peel that back with an equity lens, we can see that there's a disproportionate number of students of color that are not enrolling into a 2 or 4 year degree program. And so the opportunity becomes, how can we ensure that the young people that are not attending these 2 or 4 year degree programs have the skills, credentials, certifications, or opportunities here in Norwalk that leads to livable wage employment. The second piece I just want to bring up is that workforce development is very hot right here in the region and in the state. And we want to make sure that Norwalk is represented and tapped into both the regional and state opportunities that are coming our way, because I know we've been talking about ARPA dollars that we might not ever see the amount of dollars that are going through like this. So it's really critical that we're connecting the residents and our partners here in Norwalk to the opportunities that exist. The headline on the left is just talking about 19 opportunities that will be starting in 2023 that provide no-cost training to fill 6,000 jobs here in Connecticut. Our role is to make sure that Norwalk residents are connected to these opportunities and that we're working, across the community to build awareness of them. The second headline is really focused on these regional sector partnerships that are business-led partnerships here in the Southwest region. There's two here. One is focused on data tech enabled businesses, and the other is focused on manufacturing. The data tech one's coming out of Stanford for regionally though, and the manufacturing one's out of Bridgeport. So our role is to really make sure that our businesses here in Norwalk are tapped into these regional sector partnerships, because in 2023, there's going to be additional funding that goes down to create specialized training opportunities. And we want to make sure Norwalk is connected to those. So I shared kind of a little bit more about the needs and the opportunities for both our population here, as well as what's happening in the region and state. But I also want to share that there is also a need among the organizations and providers currently working here in Norwalk for workforce development. So we surveyed in December 2021 all the providers here in Norwalk that are connected to workforce development and got 14 responses back. And what we learned from that data was that the most common areas of need were around employer engagement, centralization, which is really around the coordination of access and opportunities and the information sharing, and then communication and marketing, and making sure that we're getting the building awareness of the opportunities to both job seekers and our community partners. So with that, I'm going to turn it over to Ria to share more.
Thank you, Jesse. So there was a great need for investment to strengthen our workforce development efforts here in Norwalk. And I just want to talk a little bit about the challenges that we're facing here in Norwalk related to workforce development. So despite employer-driven demand for skill roles, inconsistent communication and alignment between employers, service providers, educational institutions, training institutions, and the population as a whole, has resulted in underemployment and lack of medium and high skilled talent, which has resulted in a lot of residents having below living wage positions. So that's kind of the challenge that we're currently facing related to workforce development. And so there are a myriad of different organizations and partnerships that exist currently in Norwalk that are working to address this issue. However, a lot of that work is currently being done in silos. So the hope is through the creation of this position, focused on coordinating all of these various stakeholder efforts, that we can develop an integrated workforce development infrastructure and a strategy for Norwalk that will then meet employer-driven demand and lead to residents being connected with educational opportunities, employment opportunities that will lead to livable wage employment. So this graphic is a little confusing, but I'm going to break it down for everyone. So this image represents our workforce development ecosystem in Norwalk. The blue boxes in the outer circle represent the various pieces of that ecosystem and the organizations that play roles in those various pieces. So we have sector-specific skill training programs, career readiness skill training, wraparound services, job placement, financial support for employers, clients, and training and employer relations. And so my role will be working towards strengthening collaboration and coordination and connection among these stakeholders in the Norwalk workforce development ecosystem. And another aspect of my role will be to promote collaboration through the creation of this Norwalk Workforce Development Committee, which we'll get into a little bit more. So in the center, where the Norwalk Workforce Development Committee is housed in this graphic, our focus is to ensure that Norwalk residents are given access or increased access to educational and employment opportunities that will lead to livable wage employment, but also to amplify employer, local and regional partnerships to support the City of Norwalk initiatives that will meet their medium and high skill talent needs. And Jesse mentioned before, we really want Norwalk to be tapped into state and regional opportunities that are very popular right now. So another responsibility of this committee is to ensure that Norwalk is represented and tapped into those opportunities.
Awesome. So I want to share a little bit about our efforts today, and then Ria is going to share more about what our initial priorities are now that we have Ria here in place. So over the past year, we've really worked to convene the workforce development stakeholders to identify the needs and challenges. And through our partnership with the city that we're incredibly grateful for, we've been working to build collective commitment to this citywide initiative. We've also been facilitating cross-sharing of funding opportunities, many that emphasize collaboration. And before we officially posted this job posting, we convened all our stakeholders to get feedback and consensus on this position itself. And so we're super happy to have Ria here to be working in partnership with the city in this very necessary workforce development coordinator role.
So thank you, Jesse. The city has made this investment into strengthening our workforce development infrastructure here in Norwalk, and we've identified a few initial priorities. The first is the creation of this Norwalk Workforce Development Steering Committee. That'll help us to set our common agenda priorities and develop our action plan, but also the creation of a larger Norwalk Workforce Development Committee that will be meeting on a quarterly basis. Another priority is stakeholder engagement, not just at the local level, but also at the regional and state level. Mass communication of resources and opportunities. And we see that happening through the Community Resource Hub, for example, also the creation of an e-newsletter. And then resource mapping and data collection and ongoing reporting to assess where we are in our efforts. We've also identified a few key performance measures and indicators to kind of assess how close we are to our goal. So a decrease in the ALICE population, as Jesse mentioned, that's the asset limited, income constrained employed population in Norwalk, an increase in post-secondary planning for Norwalk public school graduates. Jesse shared that statistic prior that mentioned that a good portion of our graduates don't have any post-secondary plans or not enrolling in post-secondary education. Increased number of workers enrolled in and completing sectoral job training programs in Norwalk. And then finally, increased enrollment for the summer youth employment program, but also decrease in the number of disconnected youth in the greater Norwalk region. So those are a few of the indicators and measures that we're hoping to see as we implement these efforts and these efforts and coordinate our measures here in Norwalk. And yeah, that's all we have for you. So thank you.
Great, that's the last slide.
That is.
Okay, Chair, so we'll yield the remainder back to you and then facilitate any Q&A if those that have questions. You're on mute.
Yeah, I'm muted. All right, sounds great. So I do see, thank you. I do see we have a hand raised from Councilmember Burnett.
Thank you, Chair Johnson. Thank you for the presentation. My question is around, and forgive me, I did not see it in the slides, but what are your thinking or what are the strategies that you're going to undertake to eliminate the current barriers that individuals might face as it relates to finding employment, such as having possible criminal backgrounds or other obstacles that have prevented individuals or even certain groups from gaining employment? Is that part of the strategy to help get over those obstacles?
I'll jump in, and then if Jesse and Ria, absolutely, Councilman Burnett. The slide that Ria referred to as a messy, and I know we went through this very quickly, but one of those slides had all the social services organizations. So when you look at the spectrum or the continuum of workforce development, the workforce development is getting someone a livable job and successful. So that's the end game. But to your point, we have to identify where people are and meet them where they are and identify what those barriers. So part of the workforce development kind of family, if you will, is really looking at what are the social service organizations provide, what capacity do they need, and then working with them to identify the different services and resources, for example, that families need. For example, to your point, if someone doesn't have secure housing, trying to find a job is not going to be one of the main in looking at, or low income wage. So the social service network that's here in Norwalk, and even looking at from the regional perspective, they're responsible in kind of this continuum, identifying where are those barriers, where are the needs. And I'll just want to call out Open Door here in Norwalk. As you know, that they have expanded and rebranded themselves beyond just sheltering, and they have the Smile of Financial Opportunity Center. So they have a variety of services that is presently supporting our residents. And then the question becomes, is the need continues to be greater, how do we help them or bring other partners to scale up those services so that when a Norwalk resident is interested and eager to go to that next level, those barriers have already been addressed. And also just want to recognize the Alliance, formerly ABCD, is also beginning to expand with their services to ensure that residents have those skills and whatever identify. One example is simply for residents that have new jobs. This is just one example. I know that Alliance has committed to providing transportation or bus cards or transportation for at least the first month, because sometimes you get your check 2 weeks later or 3 weeks later. So those are critical resources or just issues that have been identified both from organizations or residents that we talk to ensure that we're not just putting together, having these opportunities available, but there's many barriers into getting them. And I might also add that we have even looked at looking at, those that have previous incarceration, what are those services and resources that we can bring to Norwalk to support those that are coming back home to Norwalk who've had incarceration rates. So we did, this was like the quick and fast one, but to your point, we're definitely looking at those barriers because people come with some challenging issues that may, hinder their ability to go to that next level as a desire for work for employment. I don't know if Jesse and Ria, you want to add anything?
Sure, I'll just add one thing. Thank you so much for that question, Councilmember Burnett. Part of the work that we do as we convene folks in this Workforce Development Committee is to identify those barriers together and to make sure that everyone's aware of them. And I know for sure that some of the training opportunities that are coming down the pipeline from both the region and state are focused on the reentry population, as well as some other subpopulations. So our work is really about making sure that everyone at the table is aware of the opportunities, that the information's out there, and that we're getting people connected. But part of the work is to identify barriers together and then create a shared agenda to meet those needs.
Just to echo Jesse and Director Daniel's sentiment, I think, working along with our partners that have some specialized programs that are meeting the needs of this population for training, but also for the wraparound services that they need to be competitive in the employment space. So I think just being able to identify and partner with those organizations is going to be key to serving populations that may have some barriers to the workforce.
Great, thank you.
Excellent question. I see we've got Councilmember Diana Rivelus joined us at 7:44 p.m. for the record. Evening, how are you? And we have a queue of speakers now, starting with Councilmember Ayers, and then after Councilmember Ayers, Councilmember Smith. Councilmember Ayers, you have the floor.
Thank you, Chairperson Johnson. I would like to thank Director, Deputy, what are we calling you? Mr. Daniels, he got so many hats, so many names. We'd like to thank Mr. Daniels as well as the team at Norwalk Acts for presenting this to us tonight. I have been around Norwalk long enough to know that we used to provide these services, but because of life and things happening, these services have gone to other places. So it warms my heart to see us reconnecting with tangible things to push our whole community forward. So thank you for the team for bringing this initiative forward. Jesse, I just want to, if you could possibly expand upon just a little bit of what you said about the data that you currently have around our high school students who are making conscious choices and not aligning themselves with four-year universities. Two parts. First, do you have any data prior to COVID Because sometimes when we give our data and we say within the 3 years, people go, oh, it's happening because of COVID. Do we have any data prior to COVID that speaks to that? And the second part of that question is, that population is a unique population, just like the reincarceration is a unique population. And Ria might chime in. What is the thinking, or what is the approach to kind of motivate them to participate in some of these services? You can have the best programming, you can have the best services, but if you are not engaging this population to take advantage of the service, 3 years later, we could be having the same conversation. So if you could please answer those 2 questions for me.
Thank you so much for that question, Council Member Ayers. So to your first part around the data piece, the best data that we have is essentially the number of students that are enrolling into a 2 or 4 year degree program. And then basically from that, we've calculated that there's this other population that aren't enrolling, but are graduating. The data point that I shared, and we do have it pre-COVID, we have this data that goes many years back, and that's really because of the data sharing agreement that we have with Norwalk Public Schools. We don't know what happens to those students after they graduate high school. And so that's what we're really trying to dig down to learn more about if they stay in the state of Connecticut, what sector are they employed in and what is their wage? The other piece I just want to share is that data, when I shared around the 30%, that was for high school graduates, but there's still a population of students that aren't graduating high school on time. That even kind of increases the number of Norwalk Public School students that need to have other opportunities outside the 2 or 4 year degree available. To the second question, I think there's a paradigm shift happening with the need for a college degree and the importance of short-term certification programs that are leading to kind of key employment sectors that can lead to livable wage. We're really grateful for the partnership that we have with Norwalk Public Schools. At one of the steering committee, so Norwalk Public Schools just hired a workforce development manager. I don't know if I'm saying the title right. I believe it's a manager, but we're working closely in partnership with Norwalk Public Schools to identify the students that aren't planning to go to a 2 or 4 year degree program, not like the last month of senior year, but really identifying them early through surveys and meetings with counselors. Who are these group of students and how can we kind of cater a menu of options to those students while they're still in the school building about the various opportunities that exist here in Norwalk. So I hope that answers your question. If you have any follow-ups, I'm happy to kind of share more, but that's kind of what I'm thinking at the moment.
No, you answered my question. I would love if you could at some point send me over that data. That's just something I would like to see because it really is a need, but thank you. You did answer my question.
Absolutely.
Excellent question. And it's very interesting too that the data kind of shows an expansion if we consider those still in high school. Definitely. Councilmember Smith, I see your hand up.
Yes, thank you, Chair Johnson. Actually, my question was just answered as a follow-up to Ms. Ayers' question, because of course, having been a teacher in our schools, I'm very much interested in what the partnership will be with Norwalk Public Schools and whether or not they would be a part of the steering committee. So that was answered. So thank you so much. But I would like to take a moment to thank Jesse and Ria for this great presentation, for the incredible work that you're doing on behalf of our kids cradle through career. So welcome, Ria. So thanks so much for your work.
Absolutely. And I did see Councilmember Rabelus's hand up, but maybe that was a up and down.
Oh, it was a hand to say I am so sorry.
Oh no.
I apologize. That's all. It's
Oh, you're good. You're good. I didn't mean to put you on the spot there. No worries.
No. It's just postpartum brain. I'm so sorry, guys. I'm getting back to the schedule. I'm sorry.
Oh, you are here, and that we are good. Thank you so much. We are good. And I will say too that I want to thank you all, Jesse and Ria, for coming. Ria, welcome. Really enjoyed the presentation, and I am very excited about this partnership and this work we're doing. This is such a fantastic use of investing this these precious resources that we've got from the ARPA funding. And so the dividends are really going to pay off. I had a couple questions. First off, just totally practical. Would it be possible for the council committee members to possibly have that slide deck? Is that all right? Oh, fabulous. Because I thought that grid with all of the partners was really illustrative of all the interconnected, this collective impact idea. So for me, a lot of what I'm thinking too has to do with the subpopulations with Mr. Burnett's great question that came up. So wanting to just pull that thread a little bit, it sounds like a lot of the work we're doing is to kind of figure out what are our most vulnerable populations. Is that fair to say? Okay. Yeah. Okay. I don't know if you,
Yes.
I guess a yes, no, I guess
Yes.
we're good. Okay. So I'm assuming that means, like formerly incarcerated veterans, so on and so forth, that are usually disproportionately affected by this. Okay. Great. I look forward to seeing what you all find out and what kind of, of particular Alice households, who is the most vulnerable that we can help most urgently. Secondly, I'm just thinking about the idea of this, we have these unfilled jobs in the state, we know, and I'm wondering too, is there, and it kind of gets to Councilmember Ayers' question about this connection with the schools, is there a potential for, I know we have our community college here and they're a part of this, are there ways we can fill post-secondary training that maybe doesn't exist that really we need to fill these unfilled jobs here, connect people with the jobs through the training? Is that going to be part of an end goal here to see what kind of post-secondary training opportunities we can provide as a pathway?
Jesse, you want to take that one?
Yeah, sure. So I just want to make sure I understand the question correctly. So we do have Norwalk Community College with a variety of both, right? Associate degree programs, as well as kind of on the non-credit side certification programs. But is your question about, will there be other opportunities for workforce development training that are available to young people when they graduate high school? Just want to make sure I'm clarifying.
Yeah, I guess the question, my brain's firing a little this evening, but I guess the question for me is, I think what we're going to find potentially, and if we do, I don't want to say it, but I mean, if we find, let's say that there are opportunities and we don't have the training for those opportunities, is part of this, okay, these are the training programs we're going to need to create, and then they can be housed at, say, Norwalk Community College?
Absolutely. So I think we want to take advantage of all the programming that already exists here in Norwalk, because there is a lot. And then there's some growing, such as what Chief Daniels described with the Open Doors Financial Opportunity Center. And there's other training opportunities here in Norwalk through these regional and state opportunities. So first, it's about identifying all the training here that exists and mapping out what exists. But the second piece is really, which is a deeper and more long-term part of our work, is meeting with our largest employers here in Norwalk to identify what their needs are. And if we don't have a training program that meets the needs of that particular employer, then that's where we have this infrastructure here with this Workforce Development Committee to start to kind of work on the planning. So we have King Industries and Nuvance Health and the Chamber of Commerce currently committed to our steering committee. And we're working on engaging other employers to be a part of that conversation to ensure that whatever employers need here in Norwalk, that we are able to kind of identify training opportunities or potentially create opportunities that can meet their needs.
And Chair, I just want to speak to kind of what at least I'm hearing that you're not saying. I think it's important that, when we launch these initiatives, there's always so much to do. And it's important that with this work, as Jesse pointed out, and Ria, there's these state efforts that historically, which is why I believe this department is so critical to make sure that whatever is happening to the state level, it is getting translated and communicated locally in Norwalk. So that's a big, big piece of it. I think the second piece of it is connecting whatever's happening locally in the city of Norwalk. So there's that two-prong. But then the larger initiative, sometimes we may be leading the effort. Sometimes we may be promoting the effort. Sometimes we may be collaborating with the effort, or sometimes we may just be at the table with the effort, because to Jesse's point, we do have a very strong Norwalk Community College. So if an employer just wants to work directly with Norwalk Community College, then that's fine. We'll just be promoting, say, hey, Norwalkers, there's this wonderful program happening at Norwalk. I think this investment is bringing everything together for the very first time, because we don't know what is happening collectively, so that we can look at, from like a gap analysis, what do we need to be promoting? What population is being forgotten in the existing efforts? How do we elevate them? How do we strengthen relationships? So I just want to speak to, there's a lot of moving parts, but we as this new initiative really is being deliberate around, where do we see that's lacking to uplift our entire communities? Does that make sense?
Absolutely. That was a better answer. It was an answer to a better question I didn't ask. So thank you. Yeah, that's fabulous. That's really where I would go from what I was trying to get at, because just connecting people with the jobs that exist fundamentally, but then not just that, but identifying those gaps, that's so crucial, so that we can be innovative about how we're going to approach this and not reinvent the wheel, and not double up right on anything. That's fabulous. Thank you so much, Chief. Any other comments, questions from our committee members this evening on this presentation?
I just want to echo again and say thank you for bringing this service, these services to the city of Norwalk. As council people, we do a lot of work and we push a lot of initiatives, and sometimes it doesn't translate to our constituents. But when the constituents can see physical people, they can touch, they can hear physical people connecting dots and putting puzzle pieces together, it makes some of the back work, some of the talking, some of the rearranging that we do very tangible. And what I have learned in almost a year sitting in this seat is the tangible things matter. Those tangible things that our citizens can touch really matters and helps connect the dots, so that ARPA is not this thing in the air. We got this ARPA money, but this is a tangible thing that people can see and touch. So I would like to thank the team for that.
Absolutely. Excellent point to end on there. Any other comments or I see you unmuting.
Can I?
Councilman.
Yeah, I'm just so sorry. The infant.
No. She's part of our committee now. Here we see her.
She's so being that I was late, this is just a question could have been answered already, but I just heard incarceration, right? Incarcerated members. Is there any program? Because in jails, sometimes you can have jobs that you receive that once you leave, you can't get the job. But like, let's say I was doing something in the office in the jail. Can I come out, be trained in that, and come out and actually work in that same lane? If I was cooking in jail, can I have something culinary that takes me out and goes into something culinary? Just wondering, that's always been like a question of mine. This could have been answered already. Again, I understand I was completely late, so sorry. But in just transitioning to making those that were incarcerated able to come out of incarceration and work, can they work for what they were doing in jail as well? If that makes sense, did I say that in a way that is feasible?
Yeah, that's a great question. I don't know if Jesse or even Anna Vivian, but what my response is that this is a new area for us, the city, to embark on, and we are working with our colleagues both in Stamford and in Bridgeport who do this work, the reentry programs. And so these are conversations we are having. I think what's important is really identifying who's coming back to Norwalk so we can grab them immediately to wrap around those services. And that's the work that we are kind of leaning towards, that those that are returning to Norwalk, make sure they know they have not just a place to call home, but they have a support system, which is the social service space, to make sure we can help identify what those services are. But that's a great question. I can, forward to and learn more as we continue understanding the reentry community and what the work is happening in our neighboring communities.
Yeah, I'm just going to add one.
Okay, thank you so much. I wondered that.
Sorry, Sandra. I would just add that one of our members of our steering committee is the Workplace, our regional workforce investment board, which provides a variety of programs. One of them is Platform to Employment for the reentry population. And so we're right at the beginning of this work with bringing partners to the table, but it's definitely something we'll continue to explore.
Awesome. Thank you so much.
Excellent. Any other, I don't want to take unmuting as a sign, but I saw you had a Vivian. You're good or?
Yeah, I was just going to say that I've had the pleasure of working with some of the reentry initiatives in our local communities. And they do try to match up the skills that they were able to obtain while they were incarcerated. Where they've done the majority of the work and they continue to do work is the employers, right? To have a skill, but then to find an employer that's willing to take that chance on you, right? And so that's something that as a community, I know that this initiative will try to collaborate and be an effort to foster those placements. So just to give you an example, Chipotle is a provider that is, I forget the phrasing that they use, but it's friendly to those that have some kind of criminal history. And so often those that were cooking in the kitchen while they were incarcerated will then have an opportunity to work at a Chipotle. So that just gives you an example that sometimes it is able to reintegrate into the community with the skill set that they were able to obtain. But the difficulty that I understand from the reentry community is finding that opportunity.
All right, I could definitely understand that. Thank you for that.
Thank you all so much. That's a great follow-up to Mr. Burnett's question that started us off. And I want to join my colleagues, Councilmember Ayers, for mentioning the great work here and really making that connection between tangible results for our constituents, for the residents. And I want to join them in thanking you all for coming. Thank you so much, Jesse and Ria, for this great presentation. Really appreciate it.
Thank you so much. Appreciate it.
Thank you. Thank you for having us.
Thank you all. And looking forward to the ongoing work. I'll give the floor back to our Chief Daniels for our next set of updates.
Thank you. So if you haven't checked your email yet, council members, it was released this afternoon, I believe. But let me first say that thank you for taking the journey. I know it's been a long journey from when we first embarked on our city's efforts to really look at equity and inclusion and all the things that are happening in our community. And so fast forward tonight, I am pleased, and I hope you're as excited as I am. I got 2 excitements already, then I got 1 more for tonight. But I am pleased to share with you that the city has hired its first equity and inclusion officer. And her name is Latoya Fernandez, and she will be starting November 1st. This was a highly competitive process. I looked at the numbers. We received well over 38 applications, and we narrowed it down to 3, and they were all amazing with different unique skill sets and experiences. And Latoya has a deep knowledge of community engagement, just her awareness of working with people, her love for people. She's worked in juvenile justice, as well as a track record of bringing a diverse groups of people together, especially in these most sensitive times that we've all have experienced over the past several years. Latoya, last month, just to remind you and the public, for those that are interested, we had a panel, and we were very pleased to also invite one of our neighboring towns, the city was in Stamford, Connecticut. If you were aware, Stamford also hired a DEI officer, and so we invited her to participate in our panel and our interview questions and help guide us in terms of looking at the work they're doing, and then how do we want to show up in our city. So that was a panel. And then finally, the top choices were presented to the mayor. And then we are excited to have Latoya. So for those that are interested, we will be sending out a press release in the near future. Again, Latoya starts on November 1st. We look forward to welcoming her to Norwalk. She's in Connecticut, obviously, but she has extensive work in San Jose, California, working with the mayor's office, consulting with them around the work they were doing in San Jose, empowering youth, working with marginalized communities and the like. And we're just excited that next month, Norwalk, we will have our very own equity and justice. We plan to work with her, get her up to date of our efforts, but we now have a dedicated person to work with us, to lead us and consult with us so we can make Norwalk a welcoming city for all people. And we're already starting to see that. So again, thank you for your patience, if you will. It wasn't an easy journey, but we believe that now that we're able to bring a Latoya, we're ready to go to work and do some exciting things for our community. So that's the only update I have today.
But that's quite an update.
I think so. I think it is. I think it is.
That is a good update. Oh my goodness. Wow. I'm grateful for that. I'm really happy that this is something we can now share, and all the hard work has come to fruition. I mean, the idea was born out of this committee.
Yes.
And Councilmember Ayers, my goodness, I won't put you on the spot yet, but I think we've got Greg Burnett with his hand up. So we'll start with our Councilmember Burnett.
It is exciting.
It is.
Thank you, Chair Johnson. Yes, this is great news on so many reasons, on so many fronts, that we're bringing focus to diversity, equity, inclusion here in Norwalk. Not that we didn't have the focus, but we have even more of a focused approach by having an individual to lead the effort as a key focus of their job responsibility. My question, though, is, and I may not have the answer right now, but I'm curious as to, what are the expectations for the first 90 to 120 days? We have so much to tackle here, but what are the priority items that you see for the next 90, 120 days as the chief comes on board to really focus on?
Yeah, that's a great question. And I just caution that I just want to make sure that we manage our expectations. And having myself been a new employee to the city of Norwalk, 90 days is not a long time. It takes time to meet people. But I think the key piece is one of the big pieces is the outreach to let Norwalkers, in my opinion, that we delivered on this promise while it took some time. So obviously we would want her to get acclimated within our city government, understanding how we do things in Norwalk. We want her to meet as many people as possible. But I think we were cautious around laying out this plan. I think, I'm not a DEI specialist and know what internal is, but we also wanted to respect her expertise and the knowledge that she will bring to kind of help us think through based on what we've done. And we definitely want to share with her the efforts that we went forth, and then be able to then articulate, a plan, to our city around this is what those opportunities or activities will look like. Definitely working with our HR team, because there's a lot to be done, and it's only one person. So she's not, she doesn't have a team. So I think for me, from my opinion, want to respect this as one person, and just have to be very clear on what the expectations are and what is possible with one person for a city our size.
Excellent. Thank you, Councilmember Burnett. Councilmember Ayers.
I'm having mixed emotions. I want to scream. I want to cry. I want to jump. I want to have a moment of jubilee. I am just, this is a time where we're moving from effort to action as a city. In this moment, I remember B. Brown, Councilmember Dumas, Councilmember Hilliard, D. Davis, these people on before us who did this type of work without any recognition, and we come to 2022 to say that Norwalk has had enough and we are turning the page to do better work. And so I'm really serious. I am trying not to cry. Because the impact of this person and the work that this person is going to do will be felt for generations. I have realistic expectations. I'm sorry. I have realistic expectations of Ms. Fernandez, and I can't wait to meet with her and partner with her to challenge us to do the work. And when I say us, I mean all of us, elected, unelected, city officials, all of us, to do the work to make sure that Norwalk is really the beacon on the hill, that we really support and celebrate our diversity. And I just know that I could be a lot more eloquent than this right now, but my emotions are really very raw right now because this person has so much work to do. But if we all roll up our sleeves, if we all take responsibility, if we all chip in, the load will be lighter. And I think that this is right where we need to be for a time such as this. We should not have to wait for a national crisis or another terrible incident to say that we've had enough. And that might have been the reason why these conversations were brought to the forefront, because truth is we've been having these conversations for decades. We need to not let that fire die and allow ourselves to build anew and move forward in a more excellent way to really be the city that is inclusive of all people and in all ways of life. And I'm sure I'll figure out something nice to say, but my words are really just leaving me tonight. I am just really excited about where we're going as a city. So I'm going to be quiet because now I'm rambling. I'm sorry, everybody. I really am sorry.
No apology at all. No apology at all. Now I have to speak after you, council members. I don't know how I'm gonna. I think we have a lot that you've said reminds me of the journey, and a lot of what you said reminds me of how this started before the idea was brought up in the committee. Obviously, this is a big journey that has become known as it's on our agenda, the Equity and Justice for All initiative, and it's a broad initiative, and this is such a keystone part of it. What I'll say too, in addition to my jubilation on this, is the idea that we do have some work to do, and what that means now for me as the only member of the Ordinance and Community Services Committee is I have to get to work on an ordinance so we can establish that commission, because as we've been saying, we did not want to do that until we had our officer, and now here she is. So what I can probably say is I'm not going to, in the spirit of this, and as she is one person, I am not going to do that to her where she's going to show up and the third day I'm like, here's the ordinance. So to manage expectations there, I would imagine December's ordinance meeting would be the goal, to have the first conversation there about the ordinance. I'm just kind of floating that idea here, though I don't want us to be held to that if we need more time, if that's the right thing to do. But if we can make it by December, I think it's doable. I'll just say that out, for the public to know. This is part of the process of the work going ahead right now, continually. So to your point, Nicole, and to your point, Chief Daniels, like, good work can take time, but the good work is happening, and the work that we say we are doing, we are working diligently. And then when it comes to fruition like this, it's a wonderful moment. So thank you all. I appreciate what you said, Councilmember Burnett and Ayers, especially too there. Any other comments we've got for Mr. Daniels on this good evening? Wow, this is great news. I'm excited to have our new officer introduced to the community, and we will spread that good word, make sure that people know. And to welcome her heartily, like perhaps to the next committee meeting, in November. That sounds like maybe an idea. I just invited her, I guess. Yeah.
You did.
I think I did. Is that all right? All
I'm
right. we'll
sure
see.
she would be delighted
Okay,
to
we're just,
come.
we don't want to do too much too quick on just let her get her feet under her. Very good. So as this will evolve, I think that's a good question Councilmember Net raised about making sure we you know, and I think the managing of the expectations, we want her to have a solid start. So I think that that's great. There's so much work to do. And I imagine a lot of what she's going to be doing is trying to map out what she thinks needs to be done too. So
Yeah.
excellent.
And Chair, if I can,
Sure,
through
sure.
you, I think,
Oh, of course.
I just, you know, I think we have to remind, I remind myself, this work, the success of this work is relational. There's definitely strategies and activities, but I would say the hallmark and a pillar of this work is relational, which is why it takes time. You can't just jump out and do, especially with this type of work. And I think, you know, to council members, Nicole's point, if we can support her to build those relationships, because we know it's through relationships you can get people to talk and share, and that's where change and transformation often happens, through the relationship. So, you know, if we can work with her to build those relationships, introduce her to our community, I think the best is just yet to come.
Chief Downs, that's amazing. Yeah, that's right. Yeah, I'm like, when I just saw Nicole, okay. So I think that is it.
Cole,
That
no
is it.
crying.
I know.
Council member, excuse me, council member.
I am over here like thinking of deserts, so that the tears do not come. But that, and not to prolong the point, but I think that this committee needs to make a commitment to that work. And we have made a commitment to that work under the leadership of our chairperson. But we need to continue, because my colleague going to the state, I'm just claiming it right now, but we need to continue to make that commitment to do that work in community. And the best way we can show community is, one, to live community and to model community. And so I'm eager, like, I'm gonna get some balloons. Like, I'm gonna get some balloons. Like, I'm so eager to start, not to start, as I said, we're going from effort to action. We have been doing the effort. We are now going to action. So, woohoo! I'm gonna shut up now. I'm gonna be quiet.
All right, that's good. You do not need to. Like you said, Chief Downs, the good work to come is going to be uplifting. I'm not going to even try to paraphrase, because you just said it all. I'm going to look back at the tape, because that's the thesis for me. So, all right. Any other comments on this good news? I want to be mindful of, we do have an action item, so I want to be mindful of that. And I think that's it for our agenda. Once we get this action item out there, I'm trying to remember. I think how this goes is I'll read it and then we'll discuss and have a little bit of it, some information on. I know in our packets there was a good bit of information for us on this, so I'll read 5 action item. Authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to implement Viaci software, that's VEOCI software, and the services described in the relevant order form, quotes order form, which is attached as Schedule D for Health and Human Services Departments. I think I'm getting that right. Health and Human Services Departments as read, for a term of 1 year in the amount of $53,690. Sorry, my apologies, $53,639. First year total. ARPA account noted. All right. I believe then we have the item. Now we can discuss. So
I'll move that
I
for
need
you,
to
Ms.
move it.
Johnson.
I'm forgetting we need to move it, don't we?
I'll move that for you, Ms. Johnson.
Thank you.
Sure.
Thank you. It's already 8:22 and I'm forgetting the order. Thank you, Councilmember Smith. Councilmember Smith moved the item. Thank you very much. Now we can have our conversation. That's right.
Thank you. So I do have a brief slide deck just to give us some context and why we're here. I'll move quickly, and then Anna Vivian, Deanna, and Brian, and especially Brian, I'm calling you out. Brian has been one of our leaders in helping us, identify what those needs are in scope of work. So let me quickly share Oh, let me put share first. Okay. Can you all see this? Great. Okay. So background. Let me get my face out the way. Over the past 3 years and also pre 3 years under Deanna's leadership and before, the department has been investigating, researching what are these best practices for technology, and looking at all aspects of technology use. So we've conducted an internal and external needs assessment to determine what information technology needs that we think we need, what are those shortcomings, needs of staff and other stakeholders, both from a resident perspective and also from a grant making perspective. And I'll talk about that a little bit more. I also want to share that over the past 6 months, the city's IT department has been actively engaged with our departments, which has been directed by the mayor's office that any technology needs, or CFO office as well, that all technology needs and requests must be vetted, approved, and authorized by the IT department. So we're making smart investments around our IT needs, and that we're not duplicating efforts and so forth. I want to point out just quickly that during the efficiency study that was produced in March, that the community service department has adopted their reorg for the community services department. And so you can see the 3, anchor departments are now human services, which is why you'll hear, we're slowly changing the language, health and human services, and then of course our library system. And so I just wanted to just, share this with you, that part of the efficiency study that we continue to look at it on the direction of Mayor Rilling to look at, what are those opportunities that we can adopt right now? What are those opportunities we need to look in the future and so forth? And so I think when Betty spoke to her, Betsy, I can't remember her name, from Evergreen, this is a quote directly from the Evergreen Solutions report. And I'm not going to read it, but I think the first sentence says it all. One of the greatest challenges of improving our efficiency is the current state of our technology resources. And if you recall, the need to upgrade and do better and look at our entire technology has been a major theme throughout the entire document. And that also means us, our community services, human services, and our health department, especially as we continue to find or identify those smart opportunities of how we as a municipality show up and support our residents. And so another part that was from the efficiency study about recommendations of a comprehensive IT needs assessment. So I point out again that we have worked closely with the IT department, Joyce and her team, thinking about what are those needs, what is possible, does it meet our internal structures and all the different, that I'm not going to go into it, but if you want to, I'm sure Brian can assist us around making sure it's comparable and connects with our current IT infrastructure in the city. And then here's the big thing, because the action item is often about funding, that they have identified in order to do this, there will be a fiscal impact. And they know, and this is a quote directly from the efficiency study, that there will be costs associated. It will depend on the program chosen, current training rates, and et cetera. And we went through a competitive bidding process with our purchases department to come up with this particular vendor that we are proposing to move forward with. And so what is our use? We plan to use it through case management and health system software, a system that enables our departments to track specific data and information in a centralized location and to report on the data, progress, and outcomes. Currently, I think it's important for you all to know we're using Excel. It's not sustainable. It's not a tool in this manner of a city of our size, especially as we continue to work with our community residents and provide those services. We really need a professional system that can manage the work that we do. But then I think the big piece that you all will be interested in and should be in our residents is how are these investments making a difference in the lives of our residents, and the system provides the progress and our outcomes. How are we making a difference? So the proposed vendor today is VOC. And in the second bullet, I just want to emphasize they are a leader in collaboration. This is their language and continuity and response software. And the particular slide map, these are the municipalities that they are presently working with, and this is their presence throughout the state of Connecticut. We know that they're working with Stamford, they're working with New Haven, and have contract with the town of Milford and other places, and of course, organizations and firms alike. This is actually just a sample dashboard. This is not their dashboard. But again, I think you can see that we'll be able to articulate what we're doing, how we're doing, what those needs are, and then be able to share both again with you all, the Common Council, and then also to our residents. But I think the big piece that really excites me is that we are expanding our opportunities for grant making, and grant making want to know, what's the data? Tell us about what's happening. So this will allow us to really, upgrade our ability to tell our story around how we're doing, what we're doing, and what that looks like. And so when I say human services, we're talking about the family navigation program that you are also familiar with, our youth services program, our all the programs that we interface with our residents, our fair rent programs in terms of how we interact, but how we track of those that come into our departments, and then what is that experience, and then how do we then document success. And so very briefly, I'm going to ask Deanna to go a little bit more deep into the pieces or the components of the software from the health department's perspective, and then Anna Vivian will speak to specifically the human service perspective in the utilization of the software, and then Brian's going to be our resource for some of these technical questions that you all might have. Deanna.
Thank you, Lamont. So just to elaborate further on the health department, one of the main functions and features that we'll look forward to using in the system would be its emergency preparedness and response functions. So there's a lot of different tools related to inventory management, contact tracing it could expand to, all different types of infectious diseases. As we know, public health trends, there's always something new emerging, right? And so it allows us to have the infrastructure in place to be able to address any emerging health needs. It'll have the ability to help us with call down drills, both for our volunteers and our staff, and multiple ways of communicating with our staff and our volunteers. It'll help us with volunteer management and scheduling. And so we're also looking at it as a way for tracking information. If we wanted to track information on calls and complaints and be able to compile information and data related to a variety of different programs and services. And a key feature of this program too is that it allows us to expand and to utilize it in a lot of different ways. And we have Brian on our team who is very skilled in this arena, and he'll be able to help us, customize as we need moving forward. So that's what I'd like to share from the health department side. Thanks a lot.
Thanks, Deanna. Anna Vivian?
Yeah, so on the human services side, we're going to use it to really get a robust picture of all the services. So as you all know, the department was put together. It wasn't originally put together. So all of these spreadsheets that Lamont alluded to are all different. And so we don't have a way to really bring all that information together. And VOC will give us that opportunity to just have a more comprehensive picture of all the people that we're serving, the households being impacted by the services that we provide. Because right now it is a little different. One department focuses on the youth, and so the data flows from there. Other departments focus on the family, so the data flows from there. And so we don't really have a uniform way to look at it as a department as a whole. But through this process, and we've already started prepping for that, we'll actually be able to have that whole picture and present it to you in a more cohesive manner.
Thanks, Anna Vivian. So I'll close to say that I think I alluded to it, but I just want to be clear that this program or what we're doing is ARPA eligible. And when I requested the 2 million, this funding was in that 2 million that was approved from Finance Committee. So we have it in the budget. I also want to note that the 53,000, I think what's not you all, it's not noted in your documentation, 53,639 is the total, but the breakdown is 35,800 is the one-time fee. And of course, that's getting it all up in the customizations and all the different things that we want to do in the consultation to make sure it meets our needs. And then thereafter, the annual fee is 17,839. So the total is $53,639,000. Actually, when thank you for the approval. I think I put a higher number, but we found Brian has helped us identify some vendors, and VOC just came to the top. And especially, I think the big piece for us is they've already worked with municipalities, actually large enough. I think New Haven and Stanford is both larger. And so they understand municipal government, they understand what we're doing. And so through the competitive bidding process, they rose to the occasion for us to launch this for 1 year, and we would then look at it moving forward. Thank you, Chair.
This is just fantastic. I just really want to commend you, Chief, for, I mean, all the agenda items this evening just show the dedication and work of you and your department in making these plans, as my colleague said, come into action. And this is one of those, being very responsive to the efficiency study and demonstrating that to the people in Norwalk. But not only that, I mean, this is just going to help us serve everyone so much better, is the sense I'm getting. Help you do your work even better, which, I mean, you're just already here. So the level up is going to be unbelievable. So I would love to, just before I keep just talking, ask my colleagues if they have more cogent questions and insights on that. It's getting a little late. Any questions from my colleagues about this? Oh, Councilmember Burnett. Yes.
Yes, thank you, Chair Johnson. Just from putting my finance hat on for a second. So
yes, sir.
part of this will be covered by, the startup. The large percentage of the approval will be one-time startup charges from the ARPA funding. But then you mentioned this about 17,000 that is an annual fee. So I'm assuming that will now be part of an ongoing operating budget request, or how are you going to handle the ongoing yearly fee?
Yes, sir. So definitely our ARPA allows us to, purchase the program, and it also allows us to test it and pilot it. And I think that over time that, we would all see the investment, that this would be a worthy investment. To your point, or to what you're alluded to, Councilman Burnett, is that we would see the value that the city would have to make an investment. I just want to point out again, as you noted in the efficiency study, they clearly said that the technology is going to have a fiscal impact, because we don't have any of this. I can also tell you that, what I didn't emphasize is, the possibilities that I feel very strongly around. For example, I'll be coming back before you in about another month or two, that Anna Vivian and I participated with our Funders for the Family Navigation Program. And we have been approved for funding again. But one of the things they have said is the data. We do not have a mechanism to track and to put a formal acceptable format to tell our story and to be able to share outcomes. So this tool will be an investment to also potentially bring in additional funding. And I don't want to speak ahead of myself, but I am aware, just in my formal grant funding, that there are opportunities to add a 15% admin fee for so forth. But, in full disclosure and transparency, if we do feel that this program is meeting our needs, it's doing exactly what we want, and it's meeting our needs, that we would need to look to you all as to absorb it in our budget. But again, recognizing we do not have a mechanism to track the good work that we're doing at this point.
And just as a quick follow-up question, I mean, on the surface, it appears this tool is a great data tracking and reporting tool. And I have to think that, you know, that requirement is not in silo to the community services department, that other departments across the city could utilize this same type of tool to report on the good work that they're doing. Has IT looked at this to say, is there a way that we can do this citywide and get more value out of it versus just doing it for the community services department? So, you know, you always think about when you put in a software tool in a specific department, how will that tool talk to other departments? How will that tool talk to the overall city, if possible? Will we have all of these one-off measuring tools for each department? So, what is the overall city solution that could get you the information that you might need?
Well, I can't speak to the overall city, but what I can speak to is that Joyce from IT has been a part of the process right at the onset, and we are piloting this. I don't know if we want to pilot it citywide, but so we are piloting this, and to Deanna's point, there are other components that can expand. So my department is piloting it. I agreed to pilot. I think it's an opportunity for us to pilot it, and we'll look at it. And again, I'm not this expert, but I can tell you, 'cause I've just been involved in all emails. I don't know what API stands for, but I know Joyce has approved that it can speak to our dashboard system on our website. It can speak to other systems. So I didn't give you a whole full technical aspect of it, but again, through the CFO office, this had to be vetted and approved and authorized by IT in order for us to even present this to you, with the respect of what does this look like citywide and how can we expand on this moving forward. So all those factors have been considered and are being closely watched. And we just happen to be piloting it and then be able to share that, wow, this is amazing. IT may want to look at, or the city may want to look at the other tools that they have, to your point. But most certainly, this is not being done in isolation.
Thank you.
Thank you. Thank you. I just didn't, there's a whole bunch of technical stuff that that she had to sign off on. I just don't know what they are.
No, well, and thank you. I appreciate it. It's good to know that this tool can talk to the city dashboard. So, it's not information that is in silo, but it
Absolutely.
can be shared with other departments. So that's a big plus. Thank
Yes,
you.
sir. Yes, sir. Thank you. Thank you for asking the question.
Absolutely. It makes me think too that, this will as you mentioned, Chief, this will make us really competitive for funders to want to work with us because we can show real-time results, it seems, even like, and what you were saying, Director Moore, was really interesting too about emergency preparedness. That's not something that I would have thought, but I mean, it makes sense when you describe it that way, that this will help us in doing preparation for a bunch of different potential outcomes. I mean, when I was listening to this, I was thinking, like, I wonder what you could have done with this during COVID, God forbid, but I don't want to think about that kind of thing having to happen again, but it's really, that's something. And I also think too, if this goes really well, then who knows, maybe people will see the value in this data driven approach, but also that the responsiveness to the technology needs we have as a city that were so laid bare by the efficiency study. I think that's maybe will inspire some people across city governments, to your point, Councilmember Burnett, to say, hey, that actually isn't, that looks good, let's do it. So I bet there's some mobile features. If you said API, I'm thinking there's something there.
Yeah, all of that. I mean, if you read I don't know how many pages, it's all in there.
Okay, I trust Joyce.
It's
I trust
all in
you.
there.
Due diligence.
Oh, yeah.
It was a good question by Mr. Burnett. Thank you. We got that. It was a very important point. We got that absolutely here for the folks at home.
Sure, thank you, Chair. It just, and Joyce took this really serious. I mean, there was many conversations to ensure that we weren't going to just use these dollars and then say, oh my goodness, it didn't work. And again, I can't speak to the technical things that happened. I was just CC'd on everything, but I can assure you that there was many conversations, both from a programmatic perspective where we all have been in, but actually this provider actually had several individual conversations with our IT department to make sure this was the right tools that also will not just provide what we need in the immediate, but how can we use it and expand in the possibilities to use it citywide, and then, over time, 3 years, 5 years, 10 years. So all those factors were widely discussed to specificity, and it's articulated in the scope that you have. Many of those new items that you wouldn't know they were new was really determined by our IT department to make sure that we were getting the best tool for our needs and beyond.
Oh, that's great. Thank you. That's good to piece that out from our packet. I also think just as a last point, it makes sense to me too that we did, I think, as part of this, if I recall correctly, Councilmember Net, there was an authorization through ARPA. But as you said, if I'm getting this right, Chief, that this kind of came in under what the authorization was, is that right?
Yeah, so through
good.
finance,
Okay.
I requested 2 million, and then the 2 million of this funding was a part of that. I actually asked for a little bit more, so I didn't realize it was going to come under this. So
That's
the
good.
funding is already there, the count is already there.
Good.
It's just going through this process for your approval
Very good.
for the mayor to sign, so we can bring them on board and let's show our community and our efficiency and then the opportunities to share what we're doing.
Fabulous. With that, I'm ready to vote. I don't know about my colleagues. Anybody have final questions or comments? No? All right, well, I thank you, Councilmember Smith, for raising this onto the floor. We have our moment to vote. So all in favor, you can say aye or raise your hand. 1, 2, 3, 4, 5. That is unanimous. Oh, sorry, Councilmember Lucy said aye.
Yes, ma'am.
Oh, thank you. I talked over you. I apologize. Thank you for that. Aye, we are unanimous.
Thank you so much. Thank you so
All
much.
of us are unanimous. Thank you for that great presentation, the thoughtful answers to these good questions. And with that, we are at 8:45.
Motion to adjourn.
I knew it. All right.
We missed you doing that. We missed you.
I know. I knew it was going to be you because you had been here. We needed that. So, all right, we have a motion to adjourn on the floor.
Hand up?
Oh, I'm sorry.
You see Barbara has her hand up.
Oh, yes, Councilmember Smith. Thank you, Councilmember Alterman. Or was that from the vote?
I was just voting. That's fine.
Oh,
I'm good.
you did. All right. Thank you. Thank you for that. All right. Well, that means that vote to adjourn is unanimous. That means all in favor, I assume, for that. 1, 2, 3, 4, 5. Yeah, we are unanimous for adjournment. Have a wonderful evening, all.
Thank you,
all so
everyone.
much
Thank
for
you
this.
so much. Thank you.
Take care now. Be well.
Thank you.